Hi, I'm Dr. Chad Donnelly, Program Director of the Emergency Medicine Residency Program at St. Elizabeth Boardman Hospital. Thank you for your interest in our program. We understand that choosing the right emergency medicine training program is one of the most important career decisions that you will make. I've been involved in the Mercy Health system since I was a medical student. I returned to the area in 2012 after completing my emergency medicine residency training at The Ohio State University. Our residency program has full ACGME accreditation, and residents completing their residency are eligible for board certification in emergency medicine. Our 3-year program offers 9 categorical emergency medicine positions each year. We provide clinical experiences in 3 distinct teaching facilities: a busy community emergency department, an urban inner-city level 1 trauma center, and a community level 3 trauma center. These departments provide well-rounded training atmospheres that prepare our residents for their future clinical practices.
We have fantastic educational experiences, both clinically and in the didactic setting. Our education days are on Thursdays. We meet from 7:30 to 12:30, and during that time frame, we have a variety of different educational experiences we try to provide for our residents, so it's not very mundane. We don't do death by PowerPoint. We do EKG review, pharmacology review, radiology review. We also spend some time doing cases, and we use the foundations format to do so.
There's no hierarchy or anything like that in terms of critically ill patients. My first shift, my first day of intern year, I had a sick patient with meningitis, and I intubated them and did a lumbar puncture and put a central line in. That was my first day in residency, and there's absolutely no shortage of procedures by any means here.
I think a huge perk of this program is we have multiple different training facilities, ranging from our level 1 trauma center to level 3 trauma center and rural hospitals. I think it provides a variety that most programs don't offer.
I feel like we've got a great work-life balance. We're always trying to get together, even if it's just for lunch after didactics. In June, we do Med Wars, and that's really just kickball and water balloon fights and just having a great time. Last month, we did fun outdoor retreat, field day. We had axe throwing and slingshots.
There's a pretty solid work-life balance, I think. Like Carrie said, we can't have everyone hang out after a shift or all the time, but a lot of us are pretty close with each other. We hang out outside of work.
Our program offers a family atmosphere and supportive learning environment. Our residents enjoy graded clinical responsibility and the opportunity to develop their teaching skills by participating in the education of our medical students. Our faculty and staff are outstanding mentors and educators.
The materials that we provide to you are also quite varied. We realize that not everybody learns the same way, and we also know that textbook learning is not for everyone, so we do provide you text, but we also provide you with journal articles, both in electronic format and paper format. We provide you with question banks as well as podcasts, so that all of your needs can be met, and you have a number of ways in which you can see the different materials that are out there for you.
I feel like this program is definitely a hidden gem out of any other residency program. I auditioned at quite a lot of programs prior to starting here, and after having been here for over a year, I definitely would say I wouldn't want to train anywhere else.
I feel very comfortable with all the people here. Everybody makes you feel like you're at home and not really, afraid to make a mistake in front of them, which is super crucial to me for residency. Since you are learning, you're bound to make mistakes, so you need to be in a place where you're comfortable making those mistakes and learning from them.
It's really been great, and I definitely appreciate that, and I love that, and I think that I couldn't imagine myself in a different program.
Someone asked me why I would encourage you to come to our program. I would look back to my own journey in emergency medicine as a good example. I live in Pennsylvania. I drive past 3 hospitals to come here to work. I have stuck with this program. I was one of their residents many years ago. They are my family. The guys that I work with, I grew up in emergency medicine with, and I certainly love being a part of the program because the residents mean a lot to me, and being able to carry on the tradition that I was a part of is very important.
Our faculty leaders are actively practicing hands-on clinicians who work alongside our residents in the emergency department. Bedside clinical expertise, coupled with educational Backgrounds make our faculty some of the best. Ultimately, our program aims to graduate resilient, well-rounded emergency physicians who are excellent clinicians and lifelong learners. Thank you for your interest in our program, and welcome to Mercy Health.